So, good morning ma'am. So, I'm Anjik P. Coba and then from BSN1. So, I'm going to demonstrate the procedure for the hot and cold application. So, the first procedure I'm going to do is the hot application. So, the purpose of this is for the patient to relieve pain and congestion, to provide warmth, to promote healing, and to decrease muscle tone and soften exudates. So, first, we need to check for a doctor's order for any specific instructions. So next, we need to introduce ourselves to the patient. So good morning, ma'am. So I'm Anjik P. Coba and I will be your student nurse for today. So po yung nag-assist po sa procedure na ito. Can you please state your name, ma'am? What is your name po?
Pamela po ba?
Okay po, so how old are you?
18,
So when is your birthday?
June 17, 2003.
Okay. So the purpose of this, ma'am, is for you to be aware, is for you to be able to relieve the pain, congestion, and provide warmth, promote healing, and to decrease muscle tone and soften exudate. So, ma'am, saan pong banda yung masakit kayo? So, the scale of 1 to 10, ma'am, the 10 is the highest and the 1 is the lowest. So, can you please rate, ma'am, if gaano po kasakit yung naramdaman niyo? 6 po. Next, we need to perform a hand hygiene. So, you can perform a hand hygiene by performing a hand wash or a rubbing alcohol. So, next, we need to provide the patient with the privacy by closing the door and the curtains. So, ma'am, I'll be back na lang po. So, assemble lang po yung mga equipments na maksit natin gagamitin po para ma-relieve po yung pain. Okay po, ma'am? So, first, we need to place or prepare the towel. Okay? So, but before the procedures, we need to use a glove. I've already wear the glove. So next, we're going to assemble the equipments that we will be needing. So I have here a hot water. So let's just pretend that this is a hot water bag that I don't have that kind of equipment. A towel or cover cloth and a tray. So next, we're going to prepare the towel. Then we're going to check for the hot water bag for any leakage. So before pouring the hot water into the hot water bags, we need to measure that water with a bath thermometer. So let's just say that I've already measured it with a bath thermometer. So we're going to pour it to the hot water bag. Fill it. Fill the hot water bag with 2/3 of hot water. Then expel the air. Okay, so next we're going to dry the bag. Then hold it upside down to check for any leakage. Okay, so next we're going to wrap it with a towel or cover cloth. Then we're going to place it to the patient's body side. Okay, so we're done assembling the equipment. So we're going to the patient's room. So assuming that lumabas tayo or sa kabilang room tayo. So assuming napupunta tayo sa room ng patient. So hi ma'am, yung back po. So ilalagay ko na po ito hot water bag kung sa body side niyo po kung saan po yung masakit. So, ma'am, ilalagay ko na po. Saan po yung masakit, ma'am? Okay, ma'am. So, how was the temperature? Is it hot, ma'am, or hindi naman? So, ma'am, I'll go outside lang po. I'll be back or not, 15 minutes po. So, just call me ma'am if you have any concerns or if you feel any discomfort na po ma'am. So, just to state that 15 minutes na yung nakalipas, so we're back at the patient's room. So ma'am, alisin ko na po yung hot water bag. So, you need to remove the hot water bag 30 minutes in accordance to the agency protocol. Then, assess the patient with the signs and symptoms kung saan natin nilagay yung hot water bag, like burns, swelling, or redness. Then, discard the gloves that we've used into a proper disposable bag. Then next, we're going to document all the data that we've gathered. If what is the procedure that we do. Okay. Because if it is wasn't documented or if it is wasn't written, it is not done. So that's the procedure on the hot application. Thank you. So the next procedure that I'm going to demonstrate is the dry cold application. The purpose of this is to reduce pain and body temperature, to anesthetize the area, and to reduce the bacterial growth and reduce inflammation. So next, we're going to check for the doctor's order for any specific instruction. So next, we're going to introduce ourselves to the patient. So good morning ma'am. I'm Anjit P. Cuba and I will be your student nurse for today. So po yung mag-assess ma'am sa procedure na ito. Okay po ma'am. So can you please state your name ma'am?
Anjit Cuba.
So how old are you po?
14.
Okay po. So when is your birthday?
Yung 17 ako 28.
Okay po. So next, we need to perform a hand hygiene. So you can perform a hand hygiene by performing hand washing or rubbing a alcohol. Next is we need to provide the patient with the privacy. So if the door is open, we need to close it. If the curtain is open, we need to close it. So next, we're going to use a glove. So next, after wearing the gloves, we need to assemble the equipment that we will be needing. So I have here a crushed ice, so let's just pretend that na may crushed ice ito. Then the ice bag, so let's just say that this is a ice bag kasi wala akong equipment na ganun. Then, cover cloth or towel. So next, we need to crush the ice into small pieces. So let's just say that I've already crushed the ice into small pieces. Then we need to next fill the ice bag with a crushed ice into 2/3 fill. Okay, so let's just say that I've already crushed the ice and put it in the ice bag. Then place it on a flat surface, then expel the air. Then hold it upside down to check for any leakage. Okay. Then we need to wrap it with a towel or cover cloth. So we are done assembling the equipment that we will be needing. So we're going to the patient's room. So assuming that nanggaling ako sa ibang room or sa labas, so we're going to that patient's room. Ma'am, ay po, yung back po. So ma'am, saan po yung masakit sa inyo? Okay. So ilalagay ko na po ito ma'am na ice bath, okay naman? So how was the temperature ma'am? Is it cold or hindi naman? So, I'm just gonna back ma'am after 15 minutes. So you can call me and sa labas na po ako if you feel any discomfort if may consent po. Okay ma'am? So let's just say na 15 minutes na rin nakalipas. So we're going back to the patient's room. So we're going to remove the bag or the ice bag in 30 minutes in accordance to the agency protocol. And after removing, we need to discard the gloves that we've used into a proper disposable bag. Then we need to document all the data that we've gathered and if what is the procedure that we've done. So we are done with the procedure of the dry cold application. And that's the procedure for the dry cold application. Thank you.